Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Shawn Needham, along with my wife and producer, Janet, and we are in the AM 1470 KBSN studio in Moses Lake and also streaming live on my personal Facebook page. Also, the Moses Lake Professional Pharmacy YouTube site. You can catch us every Monday, 1 to 2 p.m., right here on AM 1470 and those sites. Also, we are archived on the podcast form, so look us up on SoundCloud, Spotify, Google, all iTunes, all your favorite podcast sites. Today we have on the phone line out of Yakima, Jason Larsen. I'll introduce him a little bit shortly, but as you guys can tell, I do have a black eye, and I want to tell a little bit about that story. So Friday night, one of my son's friends, who is 17 years old, a week before Friday, he asked me if I wanted to wrestle. And I said, yeah, I'll wrestle you. And I said, and I can pin you in less than a minute. Well, I haven't wrestled in like 30 years since high school. Anyway, he came back Friday and said, hey, are you still on? And I'm like, sure. So I go downstairs and I change my clothes and we wrestle. And his first shot, he hit me right smack in the eye. And when he hit me in the eye, obviously it swelled up and got black and blue. I do have video to prove that I did win the actual match. So that is a good thing. So anyway, thanks a lot, Isaiah, if you're listening or you're tuning in. Thanks a lot, Isaiah, for keeping me young. I really appreciate it. Now, my next step is I'm going to challenge you to a mountain bike race. So, and the winner gets $1,000. I know you'd like that. I challenge you any day to a mountain bike race. So, Isaiah, you're on. All right. All right. Thanks for listening to me for that. And Jason Larsen out of Yakima with Frank Benefits. He's going to talk to us a little bit about health benefits versus health insurance. Jason, are you still with us?
I am, yes.
All right. So go ahead and tell us a little bit about your story and the difference between health benefits and health insurance.
Yeah. Well, thanks, Shawn. Thanks for having me on it. And before we get too far into it, I just want to say thank you for what you're doing. Hosting a radio show and everything you're doing at the pharmacy there. This is people need to take healthcare into their own hands, and I love how you're educating people on this. I think we're heading in the right direction. So thanks for all that.
Thanks for your kind words, and we love working with people like yourself and your father-in-law, of course, at Assurance, because we need to educate and empower consumers about their health. So thank you, Jason.
Absolutely. Yeah. So my journey into healthcare was a little bit circuitous. So after college, I graduated with a degree in music business, of all things, and decided, you know what, my degree was 100% for myself, and I actually get a lot of pleasure and fulfillment out of helping other people do other things. And I could have done that in the music industry, but I decided instead to go into a nonprofit, the nonprofit sector. Ended up helping out college students for about 7 years. It was a full-time ministry job. So helped college students out for several years, just kind of helping them launch into their own life and figure out how to, live life to their fullest and all those kind of things. And then kind of decided that was there was a lot of components of that worked really well for me, but then there were other components that really wasn't using my strengths and skill set. So left that job, went into a job that basically was one to feed my family. I ended up starting a web design business and trying to help other businesses start up websites. Well, through that, my father-in-law was a physician in Yakima, still is a physician in Yakima, completely frustrated with the healthcare system. He went back to school at age 35, back to medical school, and knew that he had always wanted to take care of people as a physician, and so that's what he did at age 35. He had 3 kids, kind of major career change at that point, and then ended up getting into what he loved. And I could tell that he really loved what he was doing, and he was getting more and more frustrated with the system, and that he was spending a lot more time with the computer than he was with his actual patients. And just said, this is this is something that I can't sustain, I can't do anymore. I need to either, one, leave medicine and do something else to where I help people, or two, I need to figure out a different way to do healthcare. So we, after several months of brainstorming and coming up with ways to make his lifestyle better and also take care of people, where he could actually go home and sleep at night, we decided to come up, we opened Assurance Healthcare and Counseling Center. And little did we know, about 2 months before we opened, we realized, wait, there's this whole kind of movement of physicians around the country doing this thing called direct primary care, and we're not actually that crazy for doing this. So we opened up Assurance Healthcare and Counseling Center as a direct primary care clinic in 2014, and that has been going wonderfully. It's so rewarding to offer an affordable healthcare solution where we're educating people as far as their healthcare goes. We're offering a great solution that we believe our incentives are aligned now, which I'll probably talk about that a little bit more, but that's one of the broken parts of the healthcare system is nobody's incentives are matched up to the same thing, right? Where we, as patients in the healthcare system, we want to make sure that we are healthy human beings and getting better. Well, unfortunately, healthcare is a business, and the way that it's set up mostly right now is people only get paid when we're sick. People don't really get paid to keep us healthy. So we believe in the direct primary care setting, we're actually, everybody's motivations are the same. We're motivated, as patients, we're motivated to be healthy. At Assurance Healthcare and Counseling Center, direct primary care, we're motivated to keep people healthy. So that's been fun to do. So in the process of that, of opening up Assurance Healthcare and Counseling Center, we realized that there's so many people that get their health care through their employers. And we can reach a lot of people and educate a lot of people about their health care, but there's a lot of people that end up feeling stuck in their health care that their employer purchases for them. Well, fortunately, there's a lot of small businesses out there where these employers actually have a little more power to move away from something, basically move away from insurance, right? Or move into something that is going to work a lot better for them and their pocketbooks, and will actually take care of their employees a lot better. So as we discovered that with Assurance Healthcare, I decided to kind of play the game and go in the system. I have my insurance broker's license now, so I'm officially an insurance broker, but then we opened up a company called Frank Benefits for the purpose of helping employer groups and individuals where we can build health benefit plans that actually help people, that actually help them and put all the incentives in the right place, where people are paid to keep other people healthy, and employers don't have to pay these insane healthcare premiums that actually isn't purchasing much for the employee. So that's my journey into starting Frank Benefits.
That's a great story. So tell us, in our pre-conference call, you talked a little bit about the difference between benefits and health insurance. If for any of you that have watched my show enough or read my book, Sickened, How the Government Ruined Healthcare, part of it in there is the insurance part is what really has messed up our healthcare system, and a lot of that was government mandated. Well, most of it was. So Jason, tell me what your thoughts are about a benefit versus health insurance and kind of the history of that.
Yeah. Well, I agree. That was one of the big unknown consequences of the whole World War II wage freeze, right? Was now we introduced something that employers were purchasing that, and we're really feeling the effects of that now. But yeah, one of the big problems I think in our country right now is everybody thinks that they have health care because they have insurance, right? The health insurance card is this kind of protective, or it's this the safeguard, the security blanket that people have when they have a health insurance card. Well, if you're in the healthcare system, you know that just because you have health insurance doesn't mean you have great health care or access to great health care. Really, when I talk about health benefits versus health insurance, I think health benefits include a lot more than insurance, or there's a lot there's other opportunities outside of insurance that a lot of times work better than insurance. They give you better access, you pay less for them, and they're going to get you a lot further in your own healthcare journey, because now you don't have somebody else who's paying your bill dictating what you can and cannot get for those healthcare dollars, right? So health benefits, in my mind, looks outside of insurance. It can include insurance at points, because insurance is there for, insurance has a purpose. But the way that health insurance has gone now, it has completely left everything, it's taken up way too much of the healthcare system. There are definitely some more effective ways of purchasing healthcare than just looking towards insurance. So that's what we do at Frank Benefits, is we look at each individual's or each employer group's situation and say, how can we build a health benefits package that actually works for for what you are going to pay and what you're going to invest, and it's going to work for your employees. They're actually going to get health care that's not going to bankrupt them either, that is actually going to keep them healthy and be ultimately healthy and productive workers and all those things. It's better for everybody.
Yeah, so speak about, I think, speaking of the health insurance thing, I mean, originally even, with the wage freeze, and, the wage freeze is during World War II that the government mandated. So what Jason was talking about, for our listeners and viewers that don't know, is that the government mandated a wage freeze, which means companies could not pay. They were worried about inflation. So, which means the company couldn't lure other employees away by paying them more. So they came out with what was called hospital insurance, and so they could lure these people away with a benefit. And of course now, it's morphed into way more than hospital insurance. I mean, it's morphed into, all kinds of different coverages, but it's got incredibly expensive, a lot of it because it's government mandated. And so tell us, Jason, when the overall picture of insurance, do you believe that a health benefit is really an insurance plan? Because insurance is meant to cover a catastrophic thing, correct? Is that how you see that?
Yeah, in my mind, insurance is there for you are purchasing an insurance policy that just in case this catastrophic event happens, then you are not going to go bankrupt for this. Well, the equivalent of, let's say that car insurance ended up taking the same path that health insurance has taken, where, okay, now we have to purchase car insurance, but now our car insurance includes our gasoline, it includes our wiper blades, it includes our headlights, our blinkers, and all of these other things. Now you have these, an entity above all these auto mechanic shops and O'Reilly Auto Parts and all of these other places that now everything has to be funneled through insurance. Well, you would see prices go insanely high for those things, right? And the other thing that happens now is, in that car insurance analogy, now you would have people more worried about, does O'Reilly Auto Parts, will they take my insurance so that I can get a part for my car, versus an actual consumer that is able to shop around and say, which wiper blades are going to be best for me? Do I choose the cheaper ones that are going to maybe not last as long, or do I choose these? We can actually make an educated decision ourselves. But now, what healthcare has done is it's taken away all of those decisions from us. Now we simply look to insurance to help make those decisions, because that's the insurance that either we purchase ourselves or our employer purchases for us. And now we let them dictate where and how we can get everything else. So, in my mind, insurance is saved for those catastrophic events and everything. Right. It shouldn't be for, really 95% of our health care can be done without insurance.
I love your analogy, Jason. I just love speaking to people like you, because you talked about the wage freeze and you talked about car insurance versus health insurance, and both those are examples in my book. So it's just amazing how, you say when you guys open up Assurance Health, were you guys crazy? Well, no, there's a lot of us out here that are crazy.
Yeah. It's crazy in a good way. Right?
That's right.
Yeah.
That's right. So that wraps up our first segment. We're going to go to our first first commercial break. You're listening to Health Solutions with Shawn and Janet Needham. Be part of the show. Call in and ask Jason a question. 509-765-1470, AM 1470, KBSN in Moses Lake. Hello and welcome back to Health Solutions with Shawn and Janet Needham. If you missed our first segment, we are talking with Jason Larsen from Frank Benefits out of Yakima. Jason, you still on the line with us?
I sure am.
Perfect. All right. Well, let's lead into some actually more specific questions. So, what exactly let's just start small. What exactly can you help an individual person with when it comes to health benefits?
Yeah, great question. So when I talk with an individual about health benefits, I like to ask, there's a lot of variables, right? Like one, are you purchasing this for yourself, or do you have an employer that's offering you a plan? And if they have an employer that's offering them a plan, then we can walk through the scenarios, whether it makes sense to include one of those plans in their health benefits package, or if it could make sense to walk away from it, because there are a lot of options outside of health insurance. So then we go into what are your goals? What do you how old are you? How far are you away from that Medicare age where unfortunately now we're not a single payer system overall, but once we turn 65, we're essentially a single payer system, right? There's some ways out of that, but anyway,
well,
so we talk about some of those
I would love
options.
you to tell me how, because I wish I could opt out now. Anyway,
opt out of Medicare?
Yeah,
oh, I know.
That's a story for another show, but
it is. Yeah, there's lots of ways. There's groups of people in the U.S. that have the option to opt out of Social Security, mostly for religious reasons. That's still an option for a subset of the population, but for most of us, we can't opt out of Medicare, so we're stuck with it. So yeah, I talk with individuals about kind of their goals and even their health history. Get into, okay, what kind of health care do you actually need, are you looking for? A lot of times, I'll say about probably 90 to 95% of the time, a lot of individuals will end up benefiting from joining either a health sharing ministry or a medical cost sharing community. I'm a huge fan of those because essentially, and I know you talk about that and are very familiar with those, Shawn, too.
Yes.
The idea behind that is you have this community of people that are saying, we think we can take care of each other better than an insurance company can take care of us, so we're going to share in each other's medical needs as they come up, and we're committed to do that according to this certain set of guidelines. And they have worked wonderfully for several years. Since the Affordable Care Act has popped up, there have been several more of these medical cost-sharing communities arise because we've seen healthcare premiums go up, we've seen healthcare access to quality healthcare go way down. So there are some newer companies that are coming up and doing this idea that really started with the Christian community of just saying, hey, we're going to share in each other's burdens, and those specific burdens are going to be medical needs. So a lot of times I do recommend these medical cost sharing or health sharing ministries to people. And that being kind of more the catastrophic end of things, if there's a direct primary care clinic in their vicinity, in their area, I really push for those, because as long as those, the lead physician there or that team is following this kind of set of general guidelines when it comes to direct primary care, their incentives are right in line with those individuals' incentives of, I want to stay healthy, I want to stay away from expensive health care, I want to stay away from unnecessary medicine, because there's a lot of unnecessary medicine that is happening simply because it can be billed for. So a lot of these direct primary care clinics are going to be big helpers to a lot of the community.
Yeah, I don't think people realize, I used to call it, and of course you know this term too, but it's overutilization. And of course, one of the reasons we have overutilization is because the consumer is not usually paying the bill. So there's a lot of medical facilities that will do more things than they have to just because somebody else is paying the bill. There's a lot of overutilization. It's something I talk about in my book. Speaking of my book, it's on Kindle version on Amazon. Sickened: How the Government Ruined Healthcare and How to Fix It. There's a 6-step solution on how to fix it, and Jason is actually going into a lot of it right now because direct primary care is a fix. The cost sharing ministries or cost sharing programs are a fix. So let's keep hitting on that one individual. So you would tell one individual that, what would you tell them? You would tell them that to start to sign up with a health sharing program. Is that correct? Well, it
a lot of it depends on their own personal risk, because there might be a case where maybe their finances are in a certain place, or they might even start with just a direct primary care clinic and then remain cash pay for everything else. And this gets into this is where I think the insurance brokers and the insurance world is a little bit, they're salesmen, right? Like they want to sell insurance, and a lot of them might believe in insurance and their effects of it, but once you get into healthcare, there's other ways to pay for things, and really it's just risk mitigation, right? Where are we in a place where we can afford to mitigate our risk against a huge medical bill, or are we going to be better off saving our money, making sure we're being proactive in our own health care? Proactive in our own health care is as simple as diet and exercise and brushing our teeth,
right?
Doing all the things that we can do to make sure that we are healthy human beings. There might be a case where somebody might, maybe they don't sign up for anything and they're just a cash pay patient. I don't recommend that a lot, because a lot of times people that come to me are looking for some kind of solution. But a lot of times there's people that can just sign up for that direct primary care clinic, and that's going to get them 95% of the way there, because now a lot of times those direct primary care clinics, they are connected really well with the clinics that will actually help cash pay patients around them. A couple examples of even assurance. So let's say here's kind of a good story. There was a patient came in to us, and he has insurance, but he also uses us because he has a really high deductible, and he's colonoscopy, and it wasn't just a preventive colonoscopy. He had some GI issues. So we said, well, we could send you down to this cash clinic that's down the road about an hour, and they'll just charge you a cash price because they're not contracted with your insurance company, so you're better off there. He said, no. I pay my health care premium. I pay my health insurance premium, so they should pay for that. So send me to the local one, and I want my insurance to pay for it. That's what I buy this for. I said, okay. So we sent him to the local area, the local gastroenterologist. They charged him $8,100 for this colonoscopy. The insurance company wrote off, I think it was $3,100. Insurance company wrote off $1,700, and then ended up paying something like $3,700 of that bill. So now he has a bill, because he had insurance, he had a bill for $3,100 when it's all said and done for that colonoscopy. When what we could have done is he could have driven down the road an hour and paid $750 for that colonoscopy, and that's it.
Incredible story. I have a story like that in my book with my wife, and sorry to interrupt you, Jason, but
no,
it's just people think that if their insurance is billed and it's covered in their insurance, then they must be better off. And that is just usually not the case at all. You're better off paying out of pocket. And that's why we have this radio show, to educate and empower patients. Thank you for that story.
Well, and let's talk about this a little bit too, Shawn, because so the insurance companies no longer are motivated to lower prices in healthcare, right? You talk about this as well. But now, since the Affordable Care Act, insurance companies, their profit is tied to how much medical care they pay for. So now those insurance companies are no longer incentivized to lower the price of healthcare for consumers, because there's only two ways for them to make more profit, right? Now that their profit is tied to the amount of money they pay for medical care. Either one, they need to create more things to pay for and pay for more things for their patients, or two, they need to pay higher prices for the things that they're currently paying for. So it makes sense that a cash pay patient, if they go into a provider and say, hey, I'm a cash pay patient, and I'll even pay you up front for this service, now that's bypassed the whole negotiation process, the whole billing team, the whole I need to send an invoice and we need to wait 180 days to get reimbursed by the insurance company. Now that provider can just say, I know that we're going to make this much money up front, no questions asked. They can give cash patients a better deal day in, day out.
I mean, it's almost incredible when I hear these stories. One of the reasons I love having people on our radio show like yourself, or anybody for that matter, is because I learned so much. And, stories like that about, they have no incentive to contain cost. It's like, in any industry, it would be illegal. It's like mob tactics. I mean, it's extortion. It's fraud. It's amazing that the insurance companies are allowed to get away with this. And one of the reasons they do is because as consumers of healthcare and healthcare workers, we let them do it. And that's why we need to educate and empower patients. So I'm so glad you're here doing that, Jason. So speak more on what if someone works for an employer and they don't like their insurance? How could you help them?
Great question. There's a few different ways. So the fortunate news is there's a lot of people that are working for a small company, and when I say small company, usually that's 50 and below. But there's some smaller companies that are still nimble in that they have, maybe 250 to 500 employees, and maybe they have a little bit of a voice with their executive team. But let's use the category of that person who's working for the big, Costco or the big corporations, where really they could try to go to their manager, their hiring manager, whoever hired them, and say, listen, your health care it's not worth me paying for it. It's not worth anything. What can you do instead? If I opt out of your health care plan, can you do anything for me? The unfortunate news is a lot of those bigger companies, it's very binary. Either you get the health care plan that they offer or you don't, and then you're on this, they're not going to increase your pay for any reason. You could try to negotiate that, but oftentimes those larger companies won't. So then what those people are stuck with is, how do I navigate this health care plan? The advantage that a lot of those larger companies have is that they have several options that they can look at. There's usually a platinum or a gold plan that's going to cost them more out of their paycheck and be, quote, a better health insurance plan. All the way down to sometimes they're offered, 2, 3, 4, even if you're a school employee for the state, you're offered, I think, 5 or 6 different health care plans. Then what you do is you look at, how do you game that system? How do you say, I want to pay the least amount of money and then supplement my health insurance that I'm getting through my employer with something else? Typically it's a direct primary care clinic is kind of my de facto way of going. But how do you craft that plan for that individual, for that larger company? That's usually the option for them. Now, the people with the smaller companies have a lot more options. The best option is if you're listening to this radio show now, and now you're being educated on, hey, wait, there's other health benefit options that are out there. You can actually go to your employer and say, hey, listen, I want to help you. Our healthcare plan stinks. Can we look at getting a better healthcare plan?
Absolutely.
So that's one great option, and they can point, whether it's pointing them to a health benefits consultant, or if it's even just doing some of the research yourself and say, hey, there's better ways of doing this. Those are great options, and we've had other people doing this. Now, here's where I'm going to insert, we can talk about this a little more later too, but here's where, unfortunately, I think employees and other people will find out where the system is broken again, because here's a story. I just talked with a friend of mine, works at a local local fruit company here in Yakima. They have, I'm not sure how many employees they have, but they currently spend on a self-funded plan $2.6 million per year on their health care plan. $2.6 million. And
Just
my
on
friend
premiums.
who's an executive, his deductible is $15,000 for his health care plan. It's so bad that his family, he goes through a health sharing ministry for his family because it doesn't do them any good to add them to their health care plan. Well, the only reason that they are set up the way that they are is because the chief executive officer is really good friends with their insurance broker who has set them up for that plan, and will not listen to anybody else that brings in any kind of money-saving options or anything else. It's simply that relationship that he does not want to sever, and that insurance broker, who's down in California, by the way, has no incentive to better their plan at all. So there's broken systems out there like that anyway.
Well, you just wonder, that's probably not an isolated incident, unfortunately, and that's just how dirty the industry is, in my opinion. It has nothing to do with taking care of people's health, nothing to do with really offering the employees something that's very good. I mean, that whole thing, I mean, you think about that, $2.6 million in premiums, $15,000 deductible, all I can say is rip-off. I mean, that is a complete rip-off.
And I guarantee that broker is getting at least six figures per year from that one healthcare plan that he's selling.
Right.
And it's not even a great plan.
And so, as an employee, imagine if you could, at a big company, this is kind of what I'm getting from you. At a big company, it might be a little bit tougher, but at a smaller company, you could negotiate and say, hey, instead of taking that $1,000 a month and put it into a health benefit, why don't you give me part of that, and I decide on where I spend that money? Because I personally would not want an employer buying my health care. I want to take care of myself and my family because I feel that I am best empowered to do that. I wouldn't want an employer to decide for me where I could and couldn't go to the doctor and what I could and couldn't get. So, empowering people that they should have control of that and do if they negotiate it is very powerful. So, Jason, that wraps up our second segment. You're listening to Health Solutions with Shawn and Janet Needham, where Team Needham discuss everything healthcare. We are going to go to a quick commercial break. You are at AM 1470 KBSN in Moses Lake. Hello, and welcome back to Health Solutions with Shawn and Janet Needham. Jason, are you still on the phone with us?
I still am, yeah.
Awesome. So if you missed our first two segments, we've been talking to Jason Larsen with Frank Benefits out of Yakima, and he specializes in health benefits, not health insurance. We talked a little bit about the difference. So we talked about employees and individuals. Now, what about employers? What could you do for an employer?
Yeah, well, what I think kind of a general message that I would say to employers right now is make sure, if you are purchasing any kind of health insurance or health benefits or whatever through an insurance broker or through a company or whatever that would be, make sure that you understand how they are compensated, because that is a big issue to me. That's a big issue in the health insurance world nowadays, because again, it's another place where incentives are not aligned very much at all, because you have usually an executive of a company who their goal is they want to make a profit from their business so that they can usually help other people in their community and employ workers who they also want to care for and continue to make a profit so they can continue to exist, right? Like there's some good things that are happening in normal businesses like that. Well, a lot of times those executives don't understand the details of health care, let alone health insurance, so they trust this insurance broker to help shop around for insurance products that they feel that they need to purchase for their employees. And these insurance brokers are typically paid by commissions, and those commissions go up and down depending on how heavy of a healthcare package somebody purchases for them. Now, that's not true with every insurance company. Sometimes they get a flat rate or a per person, per head rate, no matter what package they end up selling to the employer. But a lot of them are actually percentage-based. And if an employer asks the broker to disclose everywhere where they make money, what some people will find out is that there are kickbacks happening in the insurance broker world right now that is very, you use the word like very, very mafia-esque, right? It is very, that is one of the most broken parts of the current insurance broker world. Because what will happen is, okay, it's time to renew your plan, an insurance broker will then get in touch with their employer. Usually it's just in time for them to not make any major changes or major decisions because the employer isn't thinking about health care for much of their life or much of the year other than when they need to. So the insurance broker gets in touch with them and says, well, hey, I've shopped around for you, and it looks like it's going to make the most sense to stay on your current plan. There's only a 15% increase in premiums. Everywhere else is seeing around 18 to 19% this year. So you're actually ahead of the game a little bit. Little does the employer know that insurance company has gone to that broker and said, hey, if you maintain this employer group, we will give you a retention fee. And sometimes these retention fees, I haven't seen any of them personally yet. I'm still young in my insurance broker life. But I've heard from some other insurance brokers, if you have a company of, say, 150 people and they are retained on a certain insurance plan, sometimes those kickbacks can be high 5, sometimes even 6 figures for these insurance brokers, all to keep them on the same insurance plan throughout the year.
Wow, and I laughed and giggled when I really should have cried, but I say that because when I was a commissioner on the hospital district in Grant County Hospital District 1, when I was a commissioner, that would happen every year. They'd say, oh yeah, your rates are going up 15% this year, but that's good news because on average everybody else is only 19%. So I mean, it's just what you're saying is just truth. The same thing happened when I was a commissioner at Grant County 5 Fire District. Every year they would raise it, but they would say, well, it's not as bad as other people's. And you just got to wonder what was going on behind the scenes.
Yep, exactly. So the first thing that employers should do is ask those insurance brokers to disclose 100%. And there's a great company, the name of them, they're called Health Rosetta, and they will certify insurance brokers to the kind of the Health Rosetta Way, which is basically transparency. They're all about transparency. They realize that the insurance broker system is broken, and they will actually encourage a lot of these alternative options for insurance, whether it's medical cost sharing or if we get into self-funded options, there's a lot of direct contracting that can be done with these larger companies that actually looks a lot less like insurance and a lot more like just a good health plan. But that's one of the things these employer groups can do is ask their insurance broker, one, are you Health Rosetta certified? And I want you to disclose exactly how you're getting paid and how much. Because that will be the sign of an honest broker if they're able to give up those actual numbers to them.
Yeah.
So yeah, that's one of the things they can do with their insurance brokers. The other thing is they should shop around for insurance brokers, regardless of, and maybe they don't even need one. Maybe they're a company of less than 50 people, and they might be better off just increasing just like you say, increase your employees' wages. You need to treat everybody fairly, so increase their wages and let them figure out how to do health care and send them to trusted resources like yourself, like a direct primary care clinic in the area. There's a lot of ways to go about that.
So talk a little bit about the self-funded options, because some bigger employers are doing that, correct?
Yeah. So the bigger you get, the idea behind that is you can self-fund your insurance. And there's a lot of big places that do this. All the really big ones like Amazon and all of them, they're all self-funding their own insurance. So basically what they're doing is they're pooling money themselves and then putting together a healthcare plan that works for their employees. Now, what a lot of people don't realize is you can actually do that as an employer group for as low as around 25 employees. So how that works is you actually, there's a product called, it's not reinsurance, but it's stop-loss insurance. And that employer can go and build a healthcare plan themselves, usually with the help of a broker or a third-party administrator. And they can build a healthcare plan. They purchase a little bit of insurance. It's called stop-loss insurance. So if somebody's healthcare bill goes above whatever the threshold might be, if you're a small company, it might be $60,000. If you're a larger company, it might be $250,000. But then insurance only kicks in once you meet that threshold. And then a good broker or a good benefits consultant will help build a package to help prevent a lot of those things from happening. So the easy way to go is some people will tap into a current insurance provider's network like Cigna or Aetna or Regence. And those are expensive ways to go. The people that actually do a lot of work will build a specific healthcare package for them and say, okay, I'm going to go out and contract with this direct primary care clinic, and then we're going to build another package around the hospital and around maybe this surgery center, and we're going to direct contract with a lot of those people. So there's a lot of work that can be done on the benefits consultant part to build this healthcare package that usually costs a lot less, gives people a lot better access to healthcare, and costs employees a lot less out of their pocket. And if they utilize a direct primary care clinic, they're going to get educated really well on how the healthcare system works. So there's ways to build these kind of self-funded plans for employers that I think helps keep everybody's incentives in line and helps empower employees a lot more than traditional insurance does.
Well, if you think about that stop-loss insurance you're talking about, that's what true health insurance, that's what true insurance is, whether it's health and auto or home, is that, it's, you're trying to prevent the catastrophic. And
exactly.
I think DPC, direct primary care, and especially, offices, especially with their network with specialists, like for instance, the Surgery Center of Oklahoma. I've talked and met with Dr. Keith Smith, and they're self-insured, kind of like you're talking about. Yet, and one of the reasons why is because he has access to a lot of primary. He can talk to his employees about, where to go to see primary care, and obviously any kind of surgery stuff, where that's going to go probably. And yep. It's really amazing as we build this system, how really less complicated it is, more accessible, a lot less expensive. And the key is that healthcare providers, they have to get out of the system. They have to think outside the box. They've got to go to more cash options and realize that insurance is not the answer. Insurance is not the best thing for their patients, and it will keep them in slavery for the rest of their career. So if they want to be liberated and they really want to take care of patients, they will go to a cash model like you're talking about.
Exactly, yeah. And even a lot of them, providers, physicians and providers, anybody that's in the healthcare world, they have so much power that they don't realize, because they get a lot of these mandates that are put down either from insurance companies or Medicare/government, that if they just said no, it wouldn't happen.
Right.
Because they don't have nobody. If enough of them got together and said, no, we are not going to do this, our healthcare system could change. But the problem is they aren't. So yeah, we need more and more providers to stand up and realize that healthcare can be fixed, and they're on the front lines of being able to do it.
Well, they're part of the solution. I mean, patients are part of the solution. In my book, I talk about patients being part of the solution, but healthcare providers are too. And whether you're, a doctor or a pharmacist, an ARNP, or anybody in the healthcare industry, you are part of the solution to educate and empower your patients. I think one thing that's so reassuring, Jason, is that, I love working with through our pharmacy, through Moses Lake Professional Pharmacy, I love working with doctors like your father-in-law, Dr. Edgerly. And one of the reasons why is because he's happy. And
Yeah.
I will tell you, I cannot think of a direct primary care physician or provider that is unhappy. They are all happy. And honestly, I cannot think of very many physicians in the traditional healthcare model. Bill and insurance, most of them do not like it at all. Burnout is a big issue.
Yeah, that was one of the first comments we ever received after Dr. Edgerly opened and started seeing first patients at Assurance Healthcare was, Dr. Edgerly, you seem happy again.
Right.
That was so affirming. It was great.
And he greets you in the waiting room. What a concept.
Right.
Right?
Yeah.
All right, Jason. That's we got to wrap up our show here. So, what are your parting words? The last 2 minutes we have.
Yeah, I would say I'm preaching your same message, Shawn. Let's take control of our own health care. If you feel like you don't, as a consumer, as a patient, whatever you want to call yourself, if you don't know enough, try to partner yourself with somebody who does, like Shawn, like any kind of direct primary care physician in town. Get around those people that understand the healthcare system and start to take control of it yourself, because you can. It is possible. And it's so relieving.
It is. It's liberating. It is so liberating. I am so glad that we don't have traditional health insurance anymore. I feel so liberated that we are in control of our health. So, Jason, what is the best way, if somebody has questions, what is the best way to get a hold of you?
Yeah, well, you can visit our website. We're at frankbenefits.com. If people want to email me directly, I'm very happy with that. You can just reach me at Jason, just Jason, at frankbenefits.com. I'm also hosting a couple seminars here in Yakima. I don't know if there's any Yakimites that are listening right now, but we have a couple seminars with Assurance Healthcare and Counseling Center that are Tuesday and Wednesday evenings this week at 5:30, and we kind of talk about the whole healthcare system and how we're helping to change it. So.
Hey, Jason, are you doing any kind of marketing on the web or on social media with those seminars?
We do a little bit. There should be some Facebook information there, a little bit going on LinkedIn right now as well. So you can just hit up the Assurance Healthcare and Counseling Center page, and that should be good.
Perfect. We'll put it in our show notes too, so we can help share the good news that you guys are putting out there. All right, Jason, that wraps up our show for today. We really appreciate you calling in, and this has been a great show, and we will talk to you later. You're listening to Health Solutions with Shawn and Janet Needham, where every Monday, tune in at 1 to 2 p.m., we discuss everything healthcare. I'm your host, Shawn Needham, along with my wife and producer, Janet, and we will see you Monday.